Hey guys, it's Nurse Whit here with Baby Bump Life. I wanted to discuss with you guys tonight a couple of reasons that you would go into the hospital to get checked out if you're pregnant. Now, there's many reasons that you would want to go to the hospital, and I'm not going to list all of them, just some of the most important. But if you ever feel in your gut that there's something going on and you feel like you need to get checked out, then definitely always go with your maternal instincts and your maternal feelings. And if you feel like there's something going on, get checked out, because worst case scenario, everything's fine and you get to go home, right? But the best case scenario is you come in, you get checked out, there was something going on, and we save you and baby's life. So I really believe in maternal gut and kind of going with that. But anyways, some of the most important reasons that I feel for a pregnant mom to come into the hospital would be if you're having any vaginal bleeding, if you're having any preterm contractions, so contractions before 36 weeks that are either super, getting close together, or you're having them and they're pretty painful. Those would be reasons to go in and be seen. Another reason would be if you're sick, of course, if you have a fever or just not feeling well, that's always a reason to go in. If you ever have any leaking of fluid, like you feel like maybe not your water broke, maybe you peed on yourself a little, but you aren't sure, always come in and get checked out, because there's a little swab test that we can do to determine if that is your water that broke. And sometimes your water doesn't just break like one big gush like in the movies. Sometimes it's a small little trickle. So it's always a good idea to come in and get checked out. And then one of the last reasons I would say to come into the hospital is if you're ever having decreased fetal movement, meaning you're not feeling baby move quite as much as you usually do. We'll talk more in other videos about kick counts, and your doctor or nurse midwife should be talking to you about that soon. But if you're ever feeling baby move a little bit less than they usually do, always come into the hospital, get checked out, and we can put you on the monitors and make sure that baby is okay. Now, if you ever have any other questions, you can always call the labor and delivery unit and talk with one of the nurses. I know that we offer that to patients just because sometimes you're like, am I silly? Is this a reason to go in or not? And we can talk to you over the phone and say like, hey, you should come in. We can't tell you over the phone that everything's okay. We need to see you and check you out. Or sometimes we can say like, wait a little bit, see if X, Y, and Z happen first and then come in. So I just wanted to share those with you guys. I hope it helps. Have a great night. I'll talk to you guys later. Bye.